Hello, Dr. Dave Highmarsh. In this video, we're going to talk about clinical governance. And this is really important, not only for the AKT just to be aware of the areas, but actually more for how you're going to interact with your practice, and we'll talk through it. So it consists of 7 areas that we're going to go into a bit more detail, and these are called the 7 pillars of clinical governance. So let's get to it. So what is it first? It's a framework through which the NHS organisations are accountable for their continually improving the quality of their services and safeguarding high standards of care by creating an environment in which excellence in clinical care will flourish. So if you're running a service, so like a GP practice, you need to be aware of each of these different areas and that you're taking credit and accounting for them. Interestingly, if you're, say, setting up a private clinic or anything that requires sort of external inspection, you need to be aware of these 7 areas as well. It's really important for anything that requires Care Quality Commission or CQC because they will use a lot of these areas as the basis of their investigations and when they're coming around and having a look at these services. So let's go into them. So the 7 areas are clinical effectiveness, audit, risk management, education training, patient and public involvement, IT, and then lastly staffing. So let's go through clinical effectiveness and research. So this basically is your practice keeping up to date? Are you using evidence-based medicine? Are you sort of altering your protocols or adjusting your guidelines to this? And if there are research opportunities out there, are you taking them up? So you need to prove it. So this could be simply in practice, something like quality improvement activities, quality improvement projects, regular CPD, both individually and as a practice, meeting notes of these teaching events that you're doing and any audits that you're doing as well. So moving on to audits rather nicely. Now, you should all be very well aware of audits, but just if you're not, these are 5 areas. So you've got to prepare your audit and then having a look at selecting criteria for audit. So this needs to be based on current guidelines of what you think is sort of not going right from that point. So you're going to do your initial data analysis to see how you're measuring, and then you're going to make some improvements. Okay, so based off what, you're going to change the system, change how you do things based off your audit findings, and then finally you're going to re-audit this and then look at sort of sustained improvements, and this is a round and round aspect. Third part is risk management, and within any organisation, regardless of how big or small it is, there is a risk to it, and you need to be able to identify them, document them, and also making any adjustments that you need to do. And you often put this into what's called a risk matrix. So if you're watching this as a registrar, you are a risk to the practice, okay? And so we're going to talk you through how you'd mitigate that risk, okay? And just take a pause yourself, you might be able to suss this out already. So what does the practice do to mitigate you, and what are your risks? Okay, so you're not fully trained, you may be higher, that might be even higher if you haven't done any of your exams like your AKT, SCA, and there are a high amount of your unknown unknowns from you just because you're not trained. So how do we address those risks? Well, you should all be having your weekly tutorials, you've got your portfolio to show that you're identifying your own needs, and you are released for your weekly teaching at your local scheme, and then you get regular debriefs as well, so that any patients that you've got are identified and you're sort of taken forward from there. You have a named supervisor, so that sort of continuity of mentoring should be able to help and mitigate that risk as well. Education and training, fairly as you would expect. So again, continuing professional development, both individually as a practice. But are you being released for any external training? Say if the ICB is hosting something or any local federations are hosting any things. Are you up to date with your appraisals as well? So not the practice's responsibility, but are they keeping sort of a close eye that you are up for that? If the practice has if you are employed by the practice, so as a salaried doctor, are you getting regular appraisals to push you on, to promote your own education and give you areas to develop? Patient and public involvement, so patient participation groups, are you hosting them? Do you have a newsletter? Are you sort of pushing out on social media? Are you able to deal with complaints and suggestions and sort of taking your patient feedback involved and adjusting your service accordingly? So using information IT, so this is sort of using GDPR, not GDPR, sort of, are you keeping your notes confidential, and is patient data correct and safely stored? Think about your data protection, think about all the other acts associated with it. And then finally, staffing. Okay, are you using appropriate management of staff with their annual appraisals, and are you looking after their work conditions as well? So a very quick run through about clinical governance. Other bits which would be useful sort of tie into that about GP contracts, so how are GP practices paid, and also think about how practices interact or how patients interact with a practice from initial registration all the way through and after death. Dr. Dave Hindmarsh, best of luck with your exams.